Well, good evening, everyone, and welcome to this evening's Buttercups live session. It's the first one of these sessions that we've ever done, and really glad to see so many of you here. We've still got a few people arriving, so we'll just do some brief introductions, and I'll give you a bit of a rundown of what to expect this evening, and hopefully we'll have everybody in and ready by then. Obviously it's been quite a difficult year for pre-regs and for pharmacy. And the purpose really of this session is because there is so much uncertainty around the exam, about provisional registration, and there is quite a lot of information about that now out in the public domain. But one of the things that we find year in, year out as a training provider for pre-registration trainees is you can't beat the experience of people who have been through the same process as you, admittedly in a more usual situation in previous years. But one of the things we really wanted to do is bring some of the experience of people who have been pre-regs with Buttercups before and are now qualified pharmacists, and to share some of that knowledge and perhaps to help you to identify some of those things that will be useful as you become a pharmacist. And even though you will be becoming provisional pharmacists, you are still pharmacists, and many of the things that our guests this evening are going to share with you will be very relevant. So we want to give you lots of opportunity this evening to ask questions. You'll notice one of the people that's in the participants is Jo Hyam. Jo Hyam is one of the tutors here at Buttercups. And she will be taking your questions this evening. So if you have any questions, we're halfway through, we're going to go to questions from the floor. So people who are here this evening, it will be your questions. So if you have any questions as we go through, send them to Jo, and then Jo will send them to me, and then I'll share them with our guests. So this evening we're welcoming 3 former pre-regs. I'll introduce them all individually in a moment. But before that, I'll just tell you who I am. So I'm Paul Johnson. I'm Head of Professional Development at Buttercups Training. So I oversee pre-registration training as well as public health and a few other bits and pieces as well. So my hair's considerably longer at the moment because I've not had my post-lockdown haircut yet. So we'll move on from that photograph straight away. So my 3 guests this evening, they have all been pre-regs quite recently with us. And when I asked them to help us out this evening, I said, one thing I'd really like is for you to have a think about what was one thing that you wish you'd known as a pre-reg that you now know as a qualified pharmacist, that would be beneficial for you guys, the pre-regs, the current pre-regs, to know. So I'm going to introduce them now, and I'm going to ask them to answer this question as well. Now, there's no favoritism here. I've done it in alphabetical order. They're all equally brilliant. So our first guest is Jinan Mulligan, and Jinan works in Ireland now, but she was actually the pre-registration trainee, the very first Buttercups pre-registration trainee in a split placement with community pharmacy as well. And Jinan qualified last year and is now working as a relief community pharmacist in the family business in Southeast Ireland. So welcome, Jinan.
Hi, thank you, Paul.
Okay.
So do you want me to answer my question now?
Yes, please, if you would.
Okay.
Yeah.
So the one thing I wish I had known was to believe in myself and to kind of get rid of that self-doubt, because I really did know my stuff. I did really well in the exam, but I honestly thought I was going to fail. I was so scared to go into Buttercups and tell them that I all failed. So I think the outcome is the same if you're going to self-doubt or not. You know, if you're going to pass, you're going to pass. But it's that journey that if you believe in yourself, it's a lot easier. You know, it's less stressful. You have less anxiety. And even if you're just kind of pretending to believe in yourself, that helps too. The placebo effect works, you know, in any way you want it to. So believe in yourself, less self-doubt, and you will honestly feel a lot better. the result will be the same, but you'll feel better.
Okay, that's really great. Thank you, Jinan. I think, because we have had such a difficult time recently and pre-regs have gone through some difficult circumstances, it is quite easy to doubt yourself.
Yeah.
But no, I think that sort of positive thinking really, really helpful to remind us of that. So our second guest this evening is Marissa Masiborka. I hope I've pronounced that correctly, Marissa. I didn't.
That's very rare.
Marissa. So Marissa was one of our pre-registration trainees on our Cardiff programme and is now also working in Wales for Well Pharmacy. She's a branch pharmacist, and one very interesting fact about Marissa is that she was the winner of the Chemist and Druggist Pre-Registration Trainee of the Year. So hopefully we'll hear a little bit more about that later on. But Marissa, would you like to share the one thing that you wish you'd known as a pre-reg that you now know as a qualified pharmacist?
I think the main one would be is that no one's going to get mad at you for not knowing. So don't stress about not knowing something. No patient will ever get upset at you for saying, look, let me just go check my information and I'll get back to you. And it's a learning process and you're not going to know everything your first day. So just take your time, relax. The more time that you have to yourself to think about things and formulate things, the less of a chance you're going to have to make a mistake. So, and then as Jinan said, just believe in yourself. Have that confidence, because if you don't believe in yourself, none of your patients will. So that's probably the main one.
I believe you gave us an interesting comment as well, Marissa, about using the BNF when you emailed me. What
Yeah.
was that?
Yeah. So you don't need to know the BNF inside and out, but it's a good start to know what is kind of in there. I think when I started studying, everyone was just reading and reading and reading the BNF, trying to memorize everything. You don't need to do that. You need to know what certain medicines are for, how they're used, how you can use them, but you don't need to know the specifics. So be selective, really.
Yeah. I mean, one thing we do try and get across to our trainees is the fact that the exam is all about the 5 years that you've been studying. It's not just what you can learn in the pre-reg year, but also remembering that the exam isn't about just remembering lots and lots and lots of facts. It's being able to apply your knowledge to practical situations. Would you agree with that, Marissa?
Yeah, 100%.
Yeah.
And they're not trying to trick you. There's no slippery or tricky questions. There may be some hard ones, but in real life, no one's going to try and trick you with a prescription. There's not going to be a doctor sitting there saying, "Ooh, I wonder if they'll pick this up." Like, they won't do it. So just think of it in that kind of more relaxed way, I suppose.
Fantastic. Thank you very much, Marissa. Right. Okay. And then last but certainly not least is our third guest this evening, Samira Mohammed. Samira was a pre-reg trainee with Buttercups in Nottingham. And Joe, who's here this evening taking your questions, and me, we were kind of joint tutor for you, weren't we, Samira? I think probably Joe more than me. But interestingly, Samira has started off working in community, but has now made the leap into hospital pharmacy and is now a Band 6 rotational pharmacist, and is also studying for a postgraduate diploma with De Montfort University, who I did my postgraduate diploma with. So that's very good in my book. So Samira, welcome. And if you'd also like to answer that question for us, please.
Yeah, I think the main thing I wish I'd known was how to sort of be in charge and delegate tasks to people, because when I first became a pharmacist, I found it very strange to be the one responsible when the other staff who were working with me were there so much longer. They knew the place better than me. So it was very strange to sort of say, could you do this or could you do that? In the hospital, when I was on my first ward, I tried to do everything by myself. I would never go to my technician to say, I need a few of these, we call them medrecs, drug histories done. I would just try to do it all by myself, and it's just, you can't do it all by yourself. It's too much. So eventually I was more comfortable sort of delegating tasks and prioritizing things. And I think I was so used to being told what to do by my tutor. I wasn't used to sort of asking other people to do things for me.
Yeah. That's it. I mean, it's a big leap, isn't it, when you first become a qualified pharmacist and suddenly you're in charge. But that doesn't mean you're expected to know absolutely everything. And there's lots and lots of people around that you can ask. And I think most people would much appreciate the fact, prefer it, if you ask questions rather than guess and get it wrong. And we don't guess as pharmacists. We have to do our best to get it right.
You know, I actually did a really good activity in my pre-reg when I still had a tutor, where he gave me the reins for a week, but was still there. And so I was in charge. I was allowed to give the orders. And so I did that. But while I was doing that, I asked for feedback from my colleagues on, okay, well, how did I go about delegating that task? Or was I too forceful when I asked you to do this? And part of it was like nerves. I was really scared that my friends that I was working with were going to think I was bossy, but it was really helpful for me to figure out that I was actually a little bit bossy sometimes. So they kind of drew me back from that. And that was a really good activity for me to figure out how to take charge.
Okay, brilliant. Thank you very much. Well, we've got some questions that have been sent through ahead of this evening. So we've picked out some of those, and we're going to go through those first of all. These may be your questions as well. So we'll work through those, and then we'll allow some time at the end of this session for any questions that might have cropped up during the session, and we'll do our best to answer those as well. So if you bear in mind as you are sending questions across that one's about provisional registration, that our three guests will probably not be so familiar about, but obviously you can ask us and we can get back to you later on if there's things that we can help with. But remember to send your questions through to Jo Hyam. She's the person that will deal with those for you. Okay, so our first question then, and I'm going to put this one to Marissa first of all, and then ask other people to chip in. And the first question that we had was, what are employers looking for in a newly qualified pharmacist? Because I would imagine you've got all of these people who are joining the register at the same time, all probably competing for similar jobs. What do you think, Marissa? What are your thoughts on that question?
The first one would probably be enthusiasm. You're a new pharmacist, just starting out, newly qualified, you got all these things going on. If you're not enthusiastic now, you're probably never going to be. So even if you got to fake it till you make it, act. If you're not an enthusiastic person, put it on. Just sell yourself, go into the interview, be super friendly, and be enthusiastic about services. Know which services your shop will provide, your geographic areas, things like that. If there's universities nearby, you can have lots of students as patients. Bring that up in conversation. Make your employer know that you know what to do and what's going on around you, and have a plan, really. My first job as a branch manager, that was my job coming out of pre-reg. I didn't think I would get a manager's position. Changed my mindset, went for it anyways, because at the end of the day, I didn't want to be managed by someone else. I guess, as Janine said, I'm a little bit bossy, so like I wanted to be the boss. So put yourself out there, be confident and really sell yourself, but you need to have that enthusiasm because you're going against all these other new people, like Paul's just said, but you're also competing against pharmacists that have been there for a long time. So if you show that interest in the new services and the new qualifications that you can do and what you have to bring to the table, then you've already got your foot in the door and ready to go, really.
Yeah. Jinan, do you think there's any situations where a newly qualified pharmacist might have an advantage actually over somebody who's been a pharmacist for longer?
For some employers, yes, because they want, a fresh face, and sometimes it actually kind of depends on the person. The new pharmacist can be viewed as naive and unexperienced, and then at other times you can be viewed as someone who has fresh knowledge and more knowledge than anyone else. And I think kind of pushing that in your interview will actually come out on top. Like, you're not going to start, spewing out all the information that that is up to date, but just kind of put it in there that, you know your stuff, you have just done all of this, and that is an advantage to them. Employers just want advantages to them. They might care about you a little bit. They don't really know you, so they're not going to care about you a whole lot just yet. So you need to tell them why you are going to be great for them. And your number one selling point is that you have just learned everything. Everything is fresh in your mind. So just give that to them. And, you know, that's one selling point for sure.
Definitely 5 years of fresh clinical knowledge
Exactly.
ready and waiting to go. That's
Yeah.
quite an important thing, isn't it? Samira, do you have anything to add on that one?
I think employers, they want somebody who actually wants to be there and will enjoy doing their work. And I think the main thing is that you have a passion for pharmacy and the place that you're applying to. I think as long as you're open to learning new things, that's the most important thing. Newly qualified pharmacists, they know all the the newest things that's going on. So yeah, I think so. Sell those kind of things.
That's great. I mean, in my years of being a pharmacist, I've had the opportunity to interview quite a lot of people, and I think the things that have really impressed me are where people have taken the time to find out a bit about the organisation that they're applying for a job in, because often the question will come, you know, well, why do you want to work for this company? And if people don't really know, then you've got to find something about that company that makes you really want to be there. Another tip, when I was interviewing somebody once, she had questions for individual people who were interviewing, and that really again demonstrated that she was really on the ball about what this company was about. So yeah, some useful advice there. Thank you very much. Let's move on to our second question. Our second question is, somebody has asked this already, I noticed in the chat. So I'm going to put this one to Jinan to start with. Which services do you provide in your role, and what additional training should I be considering at the end of my pre-reg? Now, I appreciate that Jinan works in Ireland. It'd be interesting to hear how things might be different there. But as somebody approaching the end of pre-reg, Jinan, what do you think? What advice could you give in this situation?
Well, I mean, so yeah, I did move to Ireland. So, and I knew before I was finished that I was going to move over for just other reasons. So I didn't actively go and look for training. I already had my flu vaccine training, and I would highly recommend that anyone do that if they're going to be in the industry that provides it, because I mean, most community pharmacies, it is a big money maker for them. So that's important, I think, if you're going into community anyways. But with regards to the other training, I think, you know, now that so many different councils and committees have different services on offer, you know, you can look into the different areas that you might want to be settling in and see what kind of services are offered in that area or in the particular pharmacy that you're going for, and kind of tailor your training to that. If you're planning on moving out of the country, you need to look at, well, is my time going to be invested in this training? You know, is that going to be a waste? For me, let's say if I had done the MUR or the NMS training, Ireland doesn't do any of that kind of a thing. Well, the government doesn't pay us for any services actually other than dispensing. So, you know, you kind of need to look at where you're going and where you're planning on climbing really before you decide what training you're going to invest your time in, because it is it's extra, you know, it's taxing on yourself to do all of this kind of thing on top of a new job or searching for a job. So my advice would be to look at where you're going, what are they going to offer, what can you offer them.
Yeah. Now, obviously, you went to university in the UK, in Manchester, didn't you?
Yeah.
And people may not have thought about this, but is it quite easy to go and work as a pharmacist in Ireland if you've qualified in this country?
Yeah, they have free movement in the EU now. With Brexit, no one's actually sure how that's going to be affected. But thankfully, Ireland and England have such a sweet deal that it's not affected between Ireland and England. And I was able to move over with no problem, other than the delay that I didn't expect, which was about a month, I think, or two even, between when I thought I was going to be qualified over here and when I actually was, because they needed word directly from the GPHC that I had passed my exam, and then there was a month of processing. So I thought I was going to be qualified when all the English pre-regs were qualified, but it took me a little bit longer. So there's a lot of, I would say, paperwork involved if you're going to move countries. But other than that, I mean, even if you move to New Zealand, I think it's about a month worth of training, and then you do a little exam. So, you know, if you're thinking about, okay, maybe I'll want to move there someday, you know, while it's all fresh in your mind, maybe take a little trip over or look into it, see what there is in other countries that you're considering moving to. Because if you have to sit exams, they're a lot harder when you are well out of university. One of the pharmacists that works for us is trying to move to Scotland, and she's jumping through hoops to get qualified by the GPHC because she hasn't done any exams in 25 years, and she's just not even in the mindset of exams. So for me, it would have been easy if I had to sit an exam again. You know, it would have been a DOS after the GPHC exam. So if you're considering moving, I would say look into it sooner rather than later. Just like with any other training you're going to do, get it done early while you know all the things and you're in the mindset. But with Ireland, it's very easy. You just come over and you sign up to the register, and it should be the same in most other EU states. But with Brexit, it might change.
Okay, thank you, Janelle. I mean, one thing you touched on there, I think is quite important, is how service is obviously different in Ireland, but I know they're different in Wales. I'm going to ask Marissa about that in a second. But in England as well, different areas will offer different services. And just because you've done smoking cessation training in one area doesn't mean you're necessarily covered in another area. It's not an ideal system, but I understand Wales is a little bit different. Is that correct, Marissa?
Yeah, so I've worked in both England and Wales is more centralized, whereas England, like as you said, is more kind of divided into counties or however you want to say it. It's all online. It's HEIW dot something, probably co.uk. I'm not sure, but if you do a quick Google search with that, and it brings up a whole dashboard. So you've got your smoking cessation, substance misuse, how to speak to vulnerable adults, how to treat them, all your standard training, and then you've got, I think there may be some kind of vaccination training on there as well, and all your extra services like EHC. There's might be some bandages training on there as well. But most employers, if you're working in a community setting in Wales, will ask you to have that completed before you start, which was what Wal told me to do. So I've done that. Super easy. Print off all of your certificates, and then you're good to go. And then that means you can you can give those services throughout Wales. So we also have a system called Choose Pharmacy, and that allows you to do certain services on there as well. Like common ailment service, which they kind of have something similar in Scotland, and they used to have it in England. So it's all kind of centralized, so to speak. So once you send in all your documents to that central place, they know that you are registered to do all those services. So it shouldn't really be an issue after that. When I started, it was kind of confusing and I didn't really know what was going on because I had all these extra qualifications from different countries. But once it's done, and it's kind of an easy visual checklist. So yeah, not too bad.
Okay. I mean, there are certain services that you can make sure that you're ready to do from day one, which will be helpful wherever you go. And you might have to do other bits of training just specific to that area. But certainly things like vaccination training, certainly making sure that you're ready to deliver NMS services, things like that are going to be valuable wherever you are. Now, Samira, I know that you worked in community first, didn't you, before you moved into hospital? Did you do any training in this area as you became qualified?
Yeah, so I had the flu vaccination training through Buttercups, and I did the MUR and NMS. I did a first aid training as well, again through Buttercups in the pre-reg. Other than that, I don't think I did anything else. I was looking to do a mental health first aid training, but I didn't end up finding where to do that. But then when I applied to hospital, we had to basically do all of those things again. So we have something called the electronic learning record, I think, or something like ESR. I forgot what it stands for, but it's a whole load of e-learning that you have to complete, like safeguarding adults, basic life support, things like that. So I had to do it all again, essentially. So things like the flu vaccination training, even though it was really fun to do, I'm not sort of insured to do it in the hospital. It's a team of nurses that go around every flu season to do the flu vaccination for the staff. I think some of the things are still worth doing if you think about hospital, like the first aid training is good for anyone, I think, any member of the public. But in terms of paying for certain courses, you're most likely going to be doing them again in hospital, provided for free. So certain things are not worth doing, I think, if you're thinking of moving to hospital.
That's interesting. I mean, I guess it's going to be different for everybody because you're all going to be looking at going to work in different areas. But I guess once you've got a job in mind or an area in mind, a couple of things that you might want to consider are looking at your local LPC, your local pharmaceutical committee. So these are the people who will be involved with developing services within a local area. So you can get that information from the PSNC website and find out who the local contacts are. So the PSNC website is a good place to look around services, service provision as well, and things that will, some of these things can make you more employable, of course. I was going to say something else and it's gone out of my head, but no, certainly the PSNC website, that is a good place to go, and obviously speak to any potential employers and say, well, what role would I be doing? What other things can I be learning? Yeah. Okay. The next question is very much directed at Samira, because there may be a number of people who've done their pre-reg in community, or maybe even a community GP practice split, but might be thinking about moving into the hospital sector. Now, obviously, hospital pre-regs are very, very competitively fought for, but it doesn't mean just because you haven't done your pre-reg in hospital that you can't become a hospital pharmacist. That's right, isn't it, Samira?
Yeah, so to apply for a hospital pharmacy position after pre-reg, you have to apply for a band 6 position. That's the banding in the NHS straight after pre-reg, which is band 5. And it's just a case of applying. I've realized that community pharmacy pre-regs actually have a lot of advantages over hospital pre-regs because they know a lot about the legal aspects, which hospital pharmacy pre-regs they don't see a lot day to day. Like things about the FP10s and things like that. Also, I feel like community pharmacists, they communicate very well with all their patients because not only do they have to give advice, but they have to keep their loyalty. As soon as a patient decides that they can't trust their pharmacist for any reason, they'll move. So you have to keep that trust, keep that loyalty, and the communication is a lot better. And also the sort of lone decision making, because you don't have your entire team sort of to help you out. So certain aspects you might have more experience in as a community pre-reg. And I think in interviews, instead of thinking about all the things that you might not have as much experience in, sort of doing drug histories and looking at bloods and that sort of hospital related things, it's worth talking about all the things that you do have experience things in and how you can transfer it over to hospital. So doing things like managing somebody, doing first aid on somebody, managing that situation, that's sort of quick thinking, and contacting patients' GPs, things like that. You can transfer all of those skills across, and I think those are really good to talk about in the interviews. In terms of knowing things about hospital, you don't really need to know that much because they have an induction program. In my hospital, it was 3 months, I think. So you don't really have to know anything. They'll teach you from the start anyway. Even if you did a pre-reg in hospital, they'll still teach you from the start because they have to teach you all the hospital systems and who you'll be working with and what wards you'll be working in and things like that. So I think it's not, I don't think there's much of a disadvantage of being a community pre-reg if you're thinking about moving to hospital. I think, in fact, it's actually a good thing. And I think a lot of hospital pharmacists and pre-reggers can probably learn a lot from the community colleagues.
That's really encouraging to hear, and I think a lot of people will be really glad to hear that, because I mean, with with the exam, with the pre-reg exam, we often hear community pre-regs say, "Oh, there's a lot of hospital focus to it," but also I train some hospital pre-regs, and they will say the opposite, that oh, there's a lot of community focus to it, and it's easy to forget that you kind of often we tend to focus on the things we can't do and forget the things that we can do very well. So that's really, really useful advice there, Samira. So if somebody did want to start to look into hospital positions, where would you look for vacancies for hospital?
So they're all on the NHS Jobs website. You can search for, it will have to be a band 6 position. You have to start at band 6, no matter how much experience you have. I think, I haven't heard of anyone going straight to band 7, but it's band 6 that you start at. And then you just apply as normal. You fill in the application form and apply as normal. I think I had 2 weeks observation placement during my pre-reg. I did a cross sector with a hospital pre-reg. I emailed my local hospital pharmacy and just asked if they were doing cross sector placements, and they were. So I managed to get 2 weeks observation, but I don't think it's needed. A lot of my colleagues who came from community that I know of, they didn't do anything like that. They had no experience in hospital at all and still managed to get in. So I think as long as you do well in the interview and showcase all your skills, anything you don't know, they can teach you.
Brilliant. Yeah, brilliant advice. It comes back to what we were saying before, doesn't it? That you can't be expected to know everything on day one of being qualified, or even within the first couple of years of being qualified, because it still is a learning process. So thank you, Samira. Okay, well, let's move on to our next question. Unless Jinan and Marissa have anything burning that they'd like to add to that. No, okay. Let's move on to this one then. I think this will be quite a straightforward question. I'm going to ask Marissa to comment on this one first of all. Do I always need professional indemnity insurance? What are your thoughts on that, Marissa?
In short, yes. In slightly less short. I would always recommend to get it, just because you got that extra coverage on your back. And at the end of the day, regardless if your employer is your family or your friends or whoever, or if you really like your boss, things like that, you are the only one that is responsible for you. So make sure that you're covered, whether it be an accident, mistake, whatever. You need to have that there just to cover yourself, just to make yourself feel a little bit more secure. And they also offer you advice, as I said before. I'm with the PDA, which you can go with. I think there's a few different ones you can go with, but they're quite easy to sign up to. And they offer a service where you can speak to a lawyer who's actually well versed in pharmacy law and things like that. So you have that advice and that backup there. And I know like the NPA does that as well. So it's just a really good thing to have, and you're making sure that you're safe. And you also need to remember that when you are making decisions, or if you're working like in a COVID pharmacy, only do things that you are comfortable with, regardless of your employer. If they're putting pressure on you to have consultations in your consultation room, when you're thinking that's not really safe right now in this climate, then don't do it. You don't have to. So just always keep that in mind, and then always protect yourself with some PDA insurance as well.
I don't think Marissa's on commission, but I do know.
No, I'm not. I swear.
No, we're not either. But I do know that PDA give free membership to pre-regs, and so it's probably worth looking into seeing what arrangements they have for provisional registration as well. But it's to me seems a bit of a no-brainer. We were having a little chat before we everybody arrived, and when I qualified, I was working with Boots, and I didn't have indemnity insurance for a couple of years because they have some sort of company insurance. But actually, knowing what I know now, I would have got indemnity insurance from day one, because you just never know when a company is going to back you up and when they're not, to be fair. So it's peace of mind. Would Samira or Jinan, do you have anything to add to that one?
Well, like personally for me, I was a few months into being qualified, and I got this random email from, I think it was the RPS, and the thing was indemnity insurance. And I went, oh my God, how have I never addressed this? Do I have indemnity insurance? And so then I went and I asked them, and it turns out I'm covered by the company. And the way they do it is they actually pay for your indemnity insurance. It's not that you're covered under the company, they just pay for it for you. So I think it's worth, asking your employer at the very beginning, what's the story here? And if they are covered, if you are covered under them, figure out what the deal is, because I wouldn't be comfortable if it was just like, no, like, we'll sort you out, don't worry. Like, you want to know, how they're sorting it out. Is it biased towards them? Are they going to favor themselves if something happens? Or, are they just paying for you? It's just basically, in my office, the invoice goes to them. But if I have any issues, I go straight to the insurer, not through the office. So it's not like they're managing it, someone else is. So that's a pretty sweet deal. But other places, they might be at more of an advantage for themselves rather than for you. So you have to figure it out.
Okay, thank you. And Samira, anything to add?
I don't really look too much into how the NHS does indemnity insurance. I just decided to have my own separate sort of from the start. And I did that last year I bought it when I was community pharmacist still. And this year I've done it again, bought it separately. So yeah.
If in doubt, it's you can never have too much insurance. So so if there's any doubt, because we're all going to make mistakes, and that first mistake that you make as a qualified pharmacist, I can remember mine. I won't tell you about it, but it just reminds you that we're human and mistakes will happen, and sometimes you might need that protection to call upon. So I will move on to the last of our questions here before we move on to questions from the floor. But I think it's going to be quite a big question, this one. And I'm going to open with Samira answering this one. There are so many resources out there for pre-registration trainees compared to what there were even a couple of years ago. So the question that came to us was, what did you find most useful when revising for the GPHC exam, and what was less helpful? So what are your thoughts on that, Samira?
So I don't know if I'm different to a lot of the other trainees. I didn't pay for a lot of these courses that are available. I was a bit poor at the time, so I didn't spend money on any of these events and things like that. I mainly used the Buttercups resources and study days, as well as reading through the BNF and the Top 100 Drugs book, which I had. My pre-reg tutor was really good. Whenever there was a drug, pretty much every day he would say pick a drug and sort of read through the leaflet, see what you would say to the patient, look through the monograph, and I would have to sort of present it back to him. For calculations, it was just things online that I looked at. Again, I didn't pay for anything special. So I found working with my friends really helpful. So a lot of my pre-reg colleagues, we would get together and do study days and ask each other questions. So that was helpful. But I think the most helpful thing was sort of looking up information and thinking in my head, what would I want to tell a patient about this drug? Occasionally, if there was time, I would ask a patient to say, hey, you've been started on this new drug. Would you like some extra information on it? I'd take them to consultation room and I would basically read out the leaflet. As much as I'd memorized, I would tell them about it. So I think that's mostly what I did. So it was mostly the Buttercups resources and just sort of looking things up throughout the year in my own time.
What I like about that is we often talk about the rule of three in pharmacy, and the fact that if you're counselling a patient, the chances are they're only going to remember kind of three important pieces of information. You might tell them lots of things, but they'll probably only retain that amount of information. So one thing I encourage people to do is to think, well, if you were counselling a patient on this drug, what are the top three things that you absolutely would want them to remember? And that can be quite a helpful approach as well as what you're saying there about working with other people. I think that's really positive.
Also with so I have a Twitter account. I actually learned a lot of things from people on there. So different people would post interesting sort of snippets, and I would read it, and then I'd tell my tutor the next day about, did you know this? So yeah.
So Janan, other than the book, obviously you've all done Buttercups programs, but other than that, did you access any other help, or what were your thoughts here?
I used to have to drive about an hour to see my boyfriend, and in the car I would play, sorry Marissa, this Canadian guy, and he had the worst accent ever.
That's horrible, isn't it?
It's this podcast, and he is a pharmacist in America, and he does this pharmacology podcast, and he just does one drug and he talks for, I don't know, like 10-15 minutes. And if you can listen to him saying oat like 50 times in like this really drawing accent for 15 minutes, it's actually like, it's a really good way to just kind of take in some information, and you don't need it all, but you know, it's just kind of there. If you're going to be listening to Ariana Grande playing in the background, why not listen to this guy? So I found that really useful, because when I was doing my pre-reg, it was like any second you could get was like so valuable, because you know, you want a social life, you want to you know, like cook, you want to go exercise, and then you also have to do full-time study. So I found any second I could get, I would do something with it. So driving in the car, that was one way. Other than that, the best thing I found was back and forth with my friend who was also a pre-reg. So we would go to the library in Nottingham, and we would just work together, sometimes in silence, but it was always really good to have someone there. And you would just every now and again do a bit of back and forth, have a bit of conversation, cry a little bit, you know, whatever happens. And I found that the most useful tool, because when you're starting to freak out by yourself and you're studying, there's no one there to calm you down. And I found that when I had a friend there, we kind of calmed each other down, and we were all, you know what, it's gonna be fine, we'll get through this. If we don't, we'll repeat together, it's gonna be okay. So that was my most useful tool, a friend, definitely.
Okay, I can see somebody's asked about what the podcast name was.
Real Life Pharmacology by Eric Christensen.
Okay,
yeah.
Thank you very much, very helpful. Marissa, over to you with this question. I'm sure there's lots we could go at with this question, isn't it?
It feels like so long ago, to be honest, but I try to forget that period of my life. No, it actually wasn't that bad. I think it's a bit late in the game now to say, but to just always be learning and ready to learn on the job, because you will be doing that for the rest of your life anyway. So you might as well. If you're dispensing something, you don't know what it is, look it up. It's so simple. I still do it now. Some things, I had a prescription today for an antibiotic that didn't even exist. So I was like, oh, okay, good thing I looked that up. Another thing that I use, because I struggle with calculations under exam conditions, and I knew that going into it. I've always been like that. It's just practice. So keep doing it and keep doing it, keep doing it, and make sure that the resources that you're using to test yourself are appropriate and actually factual. Because I've listened to a few podcasts, YouTube channels, things like that. I've actually caught their mistakes, and I'm like, no, it's not right anymore. Make sure it's in date, because things can change. Choose like 3 resources. You know, your BNF is tried and true. Pay attention to the beginning of the chapters. They hold a lot of information there that's quite useful. anything that you don't think would crop up in like a normal conversation about medicines, you probably don't need to know as of right now. And I think I used mostly Buttercup stuff and one of those, you know, those pocket books you get on Amazon, and it's got like multiple choice questions. And the main thing with that is you can test yourself and check the answers and things like that, but don't focus on what you've got wrong. Just focus on the right answer, because chances are there's probably gonna be a question similar to that, and you can kind of get your answer from there. So don't just test yourself just for the sake of finding out what you got. Take on the information and learn from those examples as well. It's probably the best thing to do, for me anyway.
That sounds really good advice. Thank you very much. I think one thing you touched on there, Marissa, which is really an important part, is that sense of keeping testing yourself. I think you all kind of touched on it really, but you know, just trying to cram it all in the last week or so beforehand is really hard going. So you know, just regularly keep recapping over whatever you've learned is usually the most effective way. We're getting quite a lot of questions coming through, and Joe's sort of ferrying them over. So we'll move on to answering some of your questions now. One of the first questions, one thing I will just mention though, is that for the Buttercups pre-regis that are here, you will have a revision session. So at the moment we're doing virtual study sessions about preparing for practice, but you will also get a similar session once the exam has been announced. We're going to set up sessions for each of our programs where you'll be able to come along, and that will be a revision session. And obviously you've got your mock exams still to come as well. So so some of those things will be addressed there. So if we but what we will do is, because we've got limited time this evening, if we haven't answered all the questions, we're going to send out an email with any points that we've missed. So so don't worry if we don't get to your question this evening. We'll do our best to respond afterwards. So first question I can see here is following on from what we're talking about there is what calculation resources would you recommend?
I used what was the name of the book, Paul? I think you gave me one.
Oh, did I?
Yeah, there was like three editions of it. It was like 1, 2, and 3.
Oh, you put me on the spot now.
There's like a blue one and a red one.
I think I have the same ones as you.
Yeah, there's
yeah.
different. I think we got them off of Amazon.
Yeah, Amazon's got everything.
Yeah, I think it's kind of like the main calculations one. But I wouldn't necessarily say that like the, you know, what one did you use? I'm going to use it, because all you're looking for is like doing as many as you can, whack them out, you know. So get as many resources as you can. If you're not sure if it's reputable, you know, it's a calculation at the end of the day. If you think the answer is wrong, move on. You've got so many more to do. Just keep moving through them. I don't necessarily think that the calculations were like as important for finding out if it's from a reputable source, because of the fact that you could just leave it behind and move on. It's not like learning a fact about the Jackson and then figuring out, oh, is that correct, and trying to find a different resource. It was just about practice. Yeah. So for me, I just did whatever I could find. If I saw one on Instagram, I would do it. But not to plug Buttercups, but I did see all the hard work they put into their courses, especially the extra ones. So if you're worried about your technique or that you're doing questions maybe wrong, I would say that like Buttercups have these extra courses that you can sign up to, and there's like help on the other end of the phone. And like I was sitting at my desk so many times when people would call with a question about a calculation, and tutors like took the time to go through it. And I think if you're struggling with calculations, then something like that, you know, a course you sign up to that you have help with is the best choice. But if it's like time conditions or just repetition that you want, just do anything that you can find.
One thing I will confess, and you may have realised this already. Buttercups, we get quite a reputation for our calculations being a bit on the difficult side. Now, what I always say quite truthfully is the ones that you will find in the mock exam you'll do later, the ones that you've perhaps done already, that they're all valid. They could all be asked in the real exam, but we probably give you more of the difficult ones, because our hope is that when you get in to do the real exam, that you will think, well, actually, no, I can do this. And a lot of people come back to us and tell us that that's their experience, having done some of the harder ones, and understand that process. Do Samira and Marissa, do you have anything else to add on calculations?
Using On Track, I think it's called.
Mm-hmm.
That was a really, really good resource for calculations, because you got the answers coming up right there. You can have your notebook there, go to the next one, keep going. I think I did, the last month of studying, I did 10 questions every day. 10 questions is not a lot. And when I got to the exam, the calculation exam, I was like, that was the easiest calculations bit I've ever done. And I struggle with them. Like my whole life I have. And then another thing to remember is, if you are stuck on a question in the exam, just keep going, skip it, come back to it. You'll probably remember it. Just skip it, because if you're struggling with it, there's probably 100 other people in that room struggling too. So just move on to the next one.
Yeah, that's really good. One thing you said there as well, Jinan, I thought was very interesting, was about practice questions, that calculations don't really date in the same way that clinical questions do.
Yeah.
So we know that there are drop boxes and WhatsApp groups and things out there with all sorts of different questions available. So any that you can lay your hand on, but do beware that some of them are copyright, so don't get in trouble.
Yeah.
But yeah, I think you're right, Jinan, that calculations don't really change that much. Clinical is a different matter. Clinical things have to be bang up to date. So
Yeah.
be aware that questions do get out of very quickly.
One thing that I did do, now this is every year during university, but I also did it at pre-reg as well, was we had this little, it was skinny little Lloyd's book, that it was like Introduction to Pharmaceutical Calculations or something, and it was like honestly the simplest things, and then it would just slowly get harder, but it brought you back to, gosh, can I multiply 7 by 15 really quickly? No. But so it was just repetition on the simplest things, building your skills from like the very base, because you're not going to be able to do those hard questions without the basics. So I think not skipping simple questions is really important, even if they seem so monotonous and boring. It's probably one of the most important things you could do, because you don't want to trip up on a question because you don't understand displacement value, because that's the small part of the question. There's lots of other things in there, but that's the basis, the element of the question. And I think going back to your roots there kind of on it will help a lot. So keeping up with the simple ones and going back and revising them was really important for me.
Yeah, brilliant. And Samira, do you have any good tips for calculations that we haven't thought of already?
What I did was how they're split into the different sections. I forgot what the titles are now, but they're all in different sections. I would search up questions online. Again, I would just do whatever questions were available, and just saw if an answer was with the question, I'll see if I got the answer. But I think because in hospital we do quite a lot of calculations, and I think in real life they're simpler than you might think, because a lot of the infusions and things like that, if you open up like flucloxacillin infusion patient information leaflet, on the bottom it has a section for healthcare professionals, and it shows you exactly how to make it up, what rate to give it at, things like that. So I think a good thing to remember is that in real life with the actual drugs, there's lots of information available on how to give it and what rate to give it and what to dilute it in, how to dilute it in. You can find all that either in the leaflet or on the EMC website. We use another resource called Medusa in hospital. It's the Medusa Injectable Drugs Guide. It sort of gives a little bit of information on how to do it. So I think with the exam, it's just practice. Again, with the basics, sometimes I would get it wrong by 1 decimal point or something like that. So if you just make sure you try not to make those really, really simple mistakes. The way that I approached the exam was I had a little key. So I would start the paper from the start, try to do the question. If I could do it, I would do it. If I couldn't do it, I would think, is this something I could do with more time? And I'd put a little key in there, or something that I probably wouldn't be able to do even if I had a lot of time, and I'd do a different key. So I'd go through the entire paper. Once I'd done the end, I'd go from the start again, do all those medium questions, and then I'd go and do all those hard questions that I wasn't sure that I could do anyway. In the end, I only missed out 3 questions. At that time, I don't think I could have done them anyway, but I managed to get everything done on time. And I feel like that was a really good key to do, even for the clinical one, to do a little symbol.
It's actually, I did something like slightly similar in my revision, was every time I corrected something, so I always corrected, I never left something just written. And I made a list of everything that I was doing wrong as I was doing it, and I was tallying up each error as I found it. So like my thing for, okay, you put the decimal point in the wrong place, might have had 3 tallies, or you carried over this wrong, 6 tallies, or you did this wrong. So then I could visually look at this sheet and look at where my weaknesses and my strengths lay, and then I could focus my energy on the questions that involve those weaknesses more so than the strengths.
Okay, that's some very, very useful advice there. Thank you very much. I think as well, don't forget that you've got mock exams to do first, and mock exams, if you pass them, that's great, but most people won't pass them, because the whole purpose of a mock exam is to try out some of these techniques, is to practice and to identify where your weaker areas are, so that you don't do those things in the real exam. So, you know, don't forget that you've still got a lot of things that will help you to go through still to come. Okay, so question here, I'll ask Marissa this one if that's all right. I've not heard from you for a little while. Which resource is the best to use for OTC as a pharmacist?
I actually have a book, but oh god, I don't know who it's by. It's called Community Pharmacy, I think. It's got like a navy blue cover with some green on it. Really good visuals, lots of skincare stuff on there. There is an OTC manual that most community pharmacies get, and I think they get it quarterly. Can't remember the name of it either. They're all quite wordy. I'm not the biggest fan of reading. I like pictures. So the community pharmacy book, I think the publisher is Elsevier. It's available on Amazon. I think it was under £20. Really good applicable stuff, and it gives you options and treatment pathways. I wouldn't say it's that important for the exam, because you're not going to be getting too many visuals. You might get a few pictures here and there. I would say focus more on BNF and calculations, but if you want something for when you're in community and you kind of have a patient coming in and they get a bit stuck, that would be a good kind of resource to have. I like it. It's when I have like a baby coming in, or if there's like a small child and I want to double check everything, then I will go to that. But yeah, I think just focus on Buttercups and that for now, and then once you're in there, go for it.
I think the question was around sort of as a pharmacist, so that's quite helpful.
Yeah, the community pharmacy book is awesome.
Yeah. And I think the pharmaceutical press, that's always worth a look at their website. They have a lot of those texts as well that you might find useful. Any other how do you deal with OTC requests, Janan? Is there any?
I'm currently writing materials for an OTC manual training for our staff. So I have this right here on my desk, Symptoms in the Pharmacy, a guide to the management of common illnesses. I don't know what edition is out now. This is by Blenkinsop and Paxton. This was our one recommended by the University of Manchester. And basically we had to read it cover to cover. And it's really good because it gives a scenario at the end of, like, you know, let's say you do cold and flu. gives a scenario, and then it gives a pharmacist's view. What do you think what would you do? And then it gives a GP's view on, well, how would you rate the pharmacist's response? And then it gives kind of a little bit of a summary and like maybe the patient's view. So, and there are a few pictures in there, Marissa, just a few.
Oh yeah.
Mostly gross ones, so they're not really great. But I wouldn't say it's the best resource for quick reference in the pharmacy. It's like a little bit wordy. So but it's very, very thorough. So, you know, if you want to know anything about pseudoephedrine and why it's not recommended in this kind of person, blah, 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 it's very good for that kind of thing, not as quick reference. Personally, I formulate my own little booklet as I go through every pharmacy. I have this little kind of a binder. And for instance, I have all of the like skin conditions in kids. I have all pictures. I have things to look out for, things like that. So anything I find that I maybe struggle with or would like a second resource on, I create one for myself, and I make my own little OTC kind of book that I bring with me everywhere. Other than that, the internet is your best friend. NHS, over here we have the HSE. The NHS sites are fantastic. They have so much information. Customers just don't really know that they exist. Like if you type sore throat NHS, you've got everything you need there. It's very quick reference. You can print it off for the patient even if you want. But you do have to be careful about things on the internet, if they're reputable or not, like, you know, mums.net, things like, you know. So I would just say, you know, as you go along, what do you want quick references to? Can you, you know, create your own little thing? That helped me a lot.
Okay. Would you have anything to add to that, Samira?
In hospital, we don't really do a lot of OTC stuff, and I kind of miss it actually. It was now if the patients have any sort of minor ailment, they'll ask their doctor or nurse, and they don't really come to me to ask them. But while I was in community, the NHS is a page, I think it's called it's either minor illnesses in children or common skin conditions in children, something like that. It was a really good page with all sorts of pictures and common things that kids could come in with. With everything else in community, my tutor was really good at guiding what to do. He basically said you can split it into 3 sections, either give them something from the pharmacy, or it could get better on its own, refer to GP or refer to A&E. And while I was doing my pre-reg year, I would think sort of this person has hay fever, and then I would look in the pharmacy and think of like the 3 best products for different symptoms you could give to somebody. And I would sort of throughout the year, I would just see different things, and through experience, I'd say, okay, this can be used for that, this can be used for that. Then eventually I would know what to recommend. And again, I'd look at the NHS website. I think it's called derm.net. There's something else with lots of pictures.
Oh yes, there's we often recommend dermnet.nz. It's a New Zealand website, and if you want to know what scabies looks like, there's probably about 20 or 30 pictures on there. And so certainly for those skin ailments, that's a very good one that we talk about.
I think in hospital you do lose it a little bit, that sort of knowledge, because if you have somebody like with a migraine or something, like straight away you'd think, oh, sumatriptan or NSAID or something, but certain things you can't sell because of different licensings and things like that. So I've actually forgotten a lot of the licensing and issues like that, because in hospital, if you want something, you sort of get it because it's prescribed by a doctor.
Yeah, golden rule, isn't it?
And you can forget, sometimes you forget that if you give patient oh, you can just buy this, and then you forget that they can't buy it because they need specific licensing.
Yeah. If there's one rule about OTC stuff that I would encourage everybody to keep in mind, is you don't go off license. Doctors' prescriptions, things like that, you know, off license, unlicensed use, but don't take the risk with OTC medicines. It's just because it will, if things go wrong, then it's your choice and you've got nothing to fall back on. Right, well, we're going to start winding up now. We've got a couple of final questions, which I think might be quite short answers, but we will start to wind up because we're just after 8:30 now. We did have a question for you, Samira. What's your favourite part about working in hospital pharmacy?
My favorite part is actually working with different healthcare professionals, especially the junior doctors. I love them a lot. They they really appreciate your help. When you go onto the ward, they'll ask you questions. How do I prescribe this? Or the nurses would ask, how do I give this? What do I dilute it in? And it's really good to help. So at the moment I'm on, it's called AMU, Acute Medical Ward, and I've actually joined the ward rounds with the doctors. So with pharmacy, you can know a lot about the medications, but sometimes you have to tailor it specifically to your individual patient, and the doctor's the best person to know their condition at that time, or maybe possible diagnosis and things like that. So I had one the other day where the patient came in with GI bleeding and they had low magnesium as well. So automatically I thought they're on omeprazole, it will lower their magnesium. But the doctor said that the GI bleeding is much more urgent and we need to sort that out first. So you can think, okay, this blood result's gone a certain way, so you have to stop a certain thing, but you have to tailor it to the patient. And where they have that knowledge and you don't, they can help you and you can help them. And that's what I really like, the fact that you can work with so many different people from different specialties, even like dietitians and physiotherapists, things like that. And you even have a big pharmacy team as well. Like you've got your fellow juniors and you've got your seniors as well. And that's what I like. It's not as lonely and it's also not as scary as working. I feel like working in community, you have to be very brave to work in community because you're by yourself. A lot of the decisions you have to, unless you have a good network of pharmacists that you know, a lot of the decisions you have to make yourself. And I feel a lot safer in hospital, even though in terms of error rates of prescriptions, they're probably a lot higher in hospital just because their prescribers are newer, they're newly qualified, they might not know as much or how to prescribe with certain formularies and different drugs. So they'll be asking you a lot of questions and there might be a few errors in there. By the time a doctor is a GP, they're actually quite senior. So they usually know what they're doing.
Okay.
It's nice to help them out and it's nice to hear feedback that you're helping them.
Okay. Thank you, Samira. That was very, very, very helpful. It kind of makes you realize how important, well, not just hospital pharmacists, but all pharmacists are. It's very easy to forget that you know, the important role that we do provide. And when you hear about those error rates, it just brings it home, really, doesn't it?
Yeah, pretty much every chart will have an error. They have to
Wow.
be a minor thing. It's not usually a serious thing, but you know, they're very busy as well, so they're saving lives and things like that. So sometimes having the perfect prescription is harder to do in that sort of environment. But that's why you're there, to help them out.
Well, we're drawing to a close, so I'm going to ask one question now to each of you, and we'll start with Marissa, if that's okay, and we'll and it's really just you know, what one other thing, have you got something else that you could provide to the people that are here this evening that we might not have touched on that might be useful for them to know?
For me, well, with regards to the exam, less is more. Chop it up into little bits and consume those little bits day to day. Don't expect yourself to go through treacherous amounts of exam review. Like in university, for example, I was one of those notorious people who'd left it all to the end. You haven't left it all to the end with this because you've been working the entire way through. So give yourself some credit. Unless your brain is like a pea, you've absorbed some of that throughout the whole year. So don't stress too much about the little bits. And then when it comes to starting your first job, make sure you assess all of your offers. Make sure the hours are going to work for you, that they got a good team in place. Make sure that you're going to be nice and comfortable. There are jobs out there. You're not going to be short for one. So make sure that you are picky and that you're going to go to a place that you're going to be able to learn and to to flourish, basically, and take all the opportunities you can to learn. It sounds cheesy, but it's true.
That's interesting. One of the comments we had was, is the market for pharmacists in the UK becoming saturated? But that would suggest otherwise.
And all, like, I'm not painting them all with the same brush, but there's a lot of pharmacists out there that are from further on generations that don't want to do MURs, they don't want to do NMS, they don't want to do those services. And businesses, that's mainly their only source of income. Same with private services and things like that. So put yourself out there and just do the work. Don't be lazy, because I've had so many locums come into my shop and the next day I'm like, what did they do? They didn't do anything. So just put your best foot forward, really, and have fun with it, because it is a fun job at the end of the day. You get to help people. It's great.
Janan, any final comments?
Well, actually, just touching on Marissa's point there, like, it is, if you're going to be a locum, just be a nice locum, because people will talk about you. You will not be brought back. You know, it's terrible to work after a locum that has sat down and decided what bikini they're going to buy for their holiday. So if you're going to be a locum, just bear that in mind, that how would you like to come into the pharmacy the next day? You know, what kind of a thing would you like to walk into a morning where the delivery hasn't been put away, or, you know, and because in Ireland we have a shortage of supply of pharmacists. So if anyone wants to come over here, you know, that'd be great. Relieve me of my 6-day week. So it's actually, there's actually kind of enough pharmacists, but locum pay is so good over here that no one wants a permanent job, and they can be pretty nasty with leaving a job until like 9 o'clock the night before and then accepting. So if anyone needs a job, come to Ireland, get a permanent job, you will be well rewarded. But I think one thing that I learned that I didn't really have before going into community, and you're just going to have to kind of learn it as you go, and you're just going to have to accept that, and realizing that you have to accept that is going to be better. And that is that confidence is not going to come to you on the first day, and that you really should work with the other healthcare professionals that you can speak to like gain more confidence. You know, if you have a prescription and you turn to your technician, you say, does that say flucloxacillin? You know, it's not on them to say yeah, it's on you to say yeah. So pick up the phone, call the doctor. And I had a huge problem with that at the start, with my confidence, and saying, oh God, he's going to think I'm super incompetent for not being able to read that this says flucloxacillin, even though all it was like a, you know, how could you possibly read that? But like, you know, and then you pick up the phone and they're like, obviously that's flucloxacillin, you know, and some of them can be quite brash and not very nice, and that is just the way of the world. They don't dislike you as a pharmacist. They don't think you're stupid. They are just busy people. Some of them are just not nice people, and you kind of just need to accept that, and just realizing that, you know, you're gonna be afraid to do these kind of things, and just push yourself to do them. That's kind of what I've had to learn as we go. At the start, you know, I wouldn't even want to speak to the community health nurse. I'd be like, oh no, I have to do it all myself. This is all my responsibility. The prescription has left them. It's with me now. And I think, you know, like Samira said, you're very alone in community pharmacy. Use your network as much as you can. I know when you try to call a hospital, it's not going to be easy. You're going to be put through one line to the next line to the next line, only to be hung up on the ward. Don't let that put you down. Call them right back. You know, keep going with it. And basically never make a decision unless you're happy with it is definitely the biggest thing. I mean, you know, you might be absolutely positive that says flucloxacillin, but what if it didn't? Are you really going to give that out, you know, with a 95% assurance? No, always be 100%, and always make the effort. It's not your fault if you can't read the prescription and the pharmacy is about to close and, you know, the patient is saying, well, what do I do? You find a solution, but you never make a decision unless you're sure about something. And that you'll see when you're in charge and you have to make those decisions, that it can be hard, but you just have to go with it.
Okay, brilliant. Thank you. Great advice. And Samira, any final thoughts?
So similar to what Janan and Marissa said, sort of believe in yourself. And with the, I think pharmacy doesn't always have a good sort of people don't really know what we do a lot of the time. Some of the doctors I work with, I'll be working with them for a full 3 months and they'll be like, so what exactly do you do? But I think it's always important to remember that you're always an ambassador for the profession, to always be polite and helpful and friendly. And I think one of the nicest things is that from a lot of the other healthcare professionals I work with, they always say that the pharmacy team is the nicest. They always say pharmacies, like, they're always ready to help, they're never rude, anything like that. So I think that's a really good image to have. And even on our sort of on-call shifts, sometimes the nurses or the doctors will say they're a bit nervous to call somebody senior, but they're really happy to phone the pharmacist. They'll be like, yeah, we'll call the pharmacist. If they know something, they might be able to help us out, because they see us as really approachable. And I think even the most junior sort of healthcare professional or senior consultant, they're always happy to speak to us. Sometimes it can be disheartening when you ask a question and they're like, of course it's this. But you can't take that personally. You won't know everything. And also just think that you are actually helping these patients, either by giving advice or giving the correct medications, because the amount of errors that I see in prescribing medications, you're actually saving a lot of lives. You're preventing harm by doing your job. And I think as community pharmacists, they're most accessible healthcare professional. You don't need appointments. People can just phone up or come in. And I think deep down, everyone really appreciates that. I think there needs to be more sort of public knowledge on what we do. But I think in general, the people who use us the most appreciate us. So that's good.
Excellent words. Thank you very much, Samira. I think the main message is that it may seem daunting now, but you know, it's in your hands, and pharmacy isn't a perfect profession. No profession actually is, but the job is what you make of it. I've always believed that in the 20 something years that I've been a pharmacist, and it's very true. If things aren't right, the power is in your hands to do something about that. Don't ever forget that. So we'll draw it to a close. Just to mention for those Buttercups pre-regs, that even though you're coming to the end of your 52 weeks, we are extending your training right up until you do the exam. And so we will be here and available to support you. There's all sorts of things coming your way. We will have, before the exam, every single day we put on social media a question or something useful to help prepare you in the countdown to the exam, so look out for that. Obviously the mock is yet to come. We're going to be looking for nominations for our Buttercups pre-reg of the year very soon, so also look out for that. That could be you. And we didn't get to ask you about that, Marissa, but has that helped you in your career?
I don't want to say it has, but it definitely has. It's a good talking point for interviews.
There we go.
I actually didn't put myself up for it. My pre-reg tutor did. So if you got a chance to put yourself up for that, they do a really cool dinner and a show, and it's really nice. But put your qualifications in there. Put any kind of little award or what have you on the top of your CV, because that's gonna catch them right away. And on your LinkedIn profile, I put the little C&D thingy. They sent me an award thing for it, like a little picture. I put that on there, and I got so many job offers just from that. And it's just an easy thing. Yeah. Even make one up if you want.
Don't be shy about all the things that you've done well.
Yeah.
If you don't show it, someone else will. So lots of things coming your way. Look out for the emails that will come to you from Buttercups, because we will continue to support you. One final thing I want to say is as well about the Pharmacist Support, who are running at the moment a campaign called Act Now. Now, Pharmacist Support is the charity for all people within the pharmacy profession, right from being a pharmacy student, even as far as retired pharmacists and everybody in between. We're all feeling the pressure of the effects of the pandemic at the moment, even though you may not feel so bad yourself at the moment. It can affect us all at any time. So there are lots of very valuable resources on the pharmacist support site anyway, but I do encourage you to take a little bit of time just to have a look at what they're doing to support pharmacists at the moment as well, because there's a lot of effort going into supporting the profession at a very, very difficult time. Also, some of those things that we've talked about, like indemnity insurance and revision tips and techniques and things like that, pharmacy support also have lots of fact sheets and information on that kind of thing as well. So if you've not looked at the pharmacist support website, do take some time to do that as well.
Actually, Paul, can I just say something there about, you were mentioning kind of, you know, COVID and everything. As a community pharmacist, and I'm sure I don't know, you might have realized it, Marissa, is that people can be quite stressed at the moment and not everyone's very nice. And one of the important things that I've learned from it is just not to take everything personally. You know, that might be 5 minutes of your day, but that could be that person's whole life, you know, that prescription that hasn't shown up from the doctor, and they might be really harsh to you about it. But just try not to take it personally, move on from it as quick as you possibly can, because dwelling on it just, you know, brings you down. So you'll probably find that once you become in charge of a pharmacy, that people will start bringing the complaints to you. And I found that people don't do well under COVID stress, and they take it out on you because you're the one person of their day that they can turn away from and not see again for another month. So they don't see any consequences of their actions. So just don't let it get you down, just move on from it, be polite, but don't be a pushover. But definitely just, you'll see.
Well, all there is for me to say now is thank you very, very much to Samira, to Janan and Marissa for joining us this evening. I really hope that you've all gained something valuable. I've learned some things. So I really hope you found it a valuable session. Also, thank you for Joe for doing the questions in the background there as well. If there's any questions that we haven't answered, we do have your email addresses so we can respond in that way. But do remember to follow us on social media. We're on Twitter, Facebook and Instagram. If nothing else, because you will be getting a countdown question a day right up until the exam. Usually we go from about 50 days before the exam, so that can be very, very helpful as well. So once again, thank you to you all. Thank you for attending, and enjoy the rest of your evening. Thanks a lot. Take care.
Bye.